So good morning, everyone. So after an excellent talk by Dr. Akhil Kapoor regarding pembrolizumab in resectable lung cancer, so now we will discuss about next talk about perioperative toripalimab plus chemotherapy for resectable non-small cell lung cancer. So it's a NEOTORCH randomized trial. So this was the study design. They have taken stage 2, stage 3 resectable NSCLC, EGFR ALK wild type, biopsy tissue available for the biomarker analysis and all the evaluable lesions, stratified according to stage 2 versus stage 3, what type of surgery, lobectomy versus pneumonectomy, non-squamous versus squamous, and what was the percentage of PDL1 expression. So 501 patients were randomized in 1:1. So patients had received neoadjuvant 3 cycles of toripalimab plus platinum-based therapy. The dose of so toripalimab is IgG4 monoclonal antibody against PD1. So 240 mg dose of toripalimab plus chemotherapy versus placebo plus platinum-based chemotherapy. Patients had received 3 cycles once in every 3 weeks, followed by surgery, followed by after surgery, one more cycle of chemotherapy plus toripalimab, and then maintenance immunotherapy for 13 cycles. So the primary endpoints were event-free survival. So basically, this was the interim analysis. Stage 2 cancers were excluded and stage 3 were taken. So EFS by investigator, EFS by investigator in stage 2, stage 3, major pathological response by blinded independent pathological review. And the secondary endpoints were overall survival, pathological complete response, EFS by the independent review committee, disease-free survival, safety and feasibility of the surgery. So this was the regular platinum-based regimens they have taken, docetaxel or paclitaxel with cisplatin or carboplatin for squamous, pemetrexed with cisplatin or carboplatin for non-squamous. So patients underwent radiological imaging at baseline and then after completion of neoadjuvant therapy, before the surgery and prior to again initiation of adjuvant therapy, and then every 3 months for 2 years and then every 6 months. So the EFS major pathological response was defined as 10% or less viable tumor cells in the tumor bed. The disease-free survival was defined as the time from surgery to the first documentation of disease progression, local or distant recurrence and death. And the PDL1 was so this was the different validated JS311 assay which they have taken for analyzing the PDL1 score. So this was the baseline characteristics. Most of the patients' age was 62 years. Most of the patients were male population, almost 89% in the toripalimab group. We can see the squamous histology was very common. 78% were almost like squamous histology. Stage 3A, 67%. Stage 3B in around 32%. N0, N1, N2. N2 was seen in around 68% in the toripalimab group. So we can see this was the treatment summary. Almost 202 patients, 404 patients were randomized in the toripalimab were eligible. Actually 202 in the toripalimab arm. So 100% patients received neoadjuvant therapy, adjuvant in around 71% and maintenance therapy in around 71%. So we can see almost 82% patients underwent surgery after perioperative 3 cycles of therapy. Only 18 patients surgery was not done either due to disease progression, refusal, adverse event and other. We can see the RGO resection rate was around 82% in the toripalimab group. Mostly the surgery was lobectomy in around 80% and pneumonectomy was in the 9%. So this is the event-free survival analysis. So 144 events were observed. Basically, and we can say with the median follow-up of 18 months, the median EFS was not estimable versus 15 months. We can see there is a clear difference in the curves at 1 year as well as 2 year. At 2 years, it was 64% versus 38% with a hazard ratio of 0.4 with significant p-value. So the right curve is EFS, which was done by an independent review committee. Again, we can see there is a clear difference between the curves at even at 2 years, 66% versus 46% with significant p-value with a hazard ratio of 0.4. So this was the EFS which was done in PDL1 population. We can see even less than 1%, 1 to 49, greater than 50%, all were benefited. Especially in 1 to 49, more than 50%, the hazard ratio was 0.3. and the median EFS more than 50% showed not estimable versus 15 months in the more than 50% group. So this was the EFS in non-squamous and squamous. In the median EFS in non-squamous was not reached versus 21 months, and in the squamous it was not reached versus 12.9 months in the squamous group. So this was the major pathological response rates. We can see there is a clear difference between the two, almost 48% versus 8%, with a difference of 40.2%, with again significant p-value between the placebo versus toripalimab group. This was the EFS by the pathological complete response rates. We can see there were almost 24.8% pathological complete response rate in the toripalimab group versus only 1% in the placebo arm. So we can see there is a difference of 23.7% with significant p-value. So this was the DFS not reached versus 19 months. Almost most of the patients received the toripalimab for maintenance 13 cycles. Neoadjuvant, almost all patients received 3 cycles, adjuvant 1 cycle, and then maintenance for 13 cycles. So the efficacy and safety was good in the toripalimab group. We can see this was the interim overall survival analysis. There is a 2-year overall survival of around 81% versus 74% in the interim analysis. So these are the treatment-related adverse events. Almost more than or equal to 1 event was seen in both the groups. 99% in the toripalimab, and more than 63% had a grade 3 or more side effects. We can see these were the discontinuation rates were around 9% versus 7%. Fatal adverse events were 3% versus 2%. Interruption was noted in around 28%. And then immune related adverse effects 42% versus 22%. Grade 3 or higher immune events were around 11% versus 3%. So we can see the most common adverse effects were cough, increased AST, decreased appetite, rash, as well as the hypothyroidism. So coming to the summary, the toripalimab plus chemotherapy significantly improved EFS not reached versus 15 months with the 18 months follow-up. And we can see there was a higher major pathological response rates with around 48%, and even the PCR was around 24% compared to the placebo arm. And the EFS was seen in all groups irrespective of the PDL1, even in non-squamous and squamous, but the squamous population was more around 78% in this study. Thank you.